How does testosterone affect your fertility? Well, the answer is that it does indeed affect your fertility. So if you are taking testosterone, let's just pretend this is testosterone right here. You're taking from what's called an exogenous source. Exogenous means from outside of your body. We have testosterone produced here, endogenous, which means from your testicles. It really means from inside of your body. We have an endogenous testosterone from inside of your body, exogenous testosterone from outside of your body. Your brain picks up on the testosterone levels regardless of where it's coming from. Then your brain is going to send out these signals that are then going to talk to your testicles. This signal makes testosterone. We call it the luteinizing hormone or lion's hormone. FSH is called the follicle slimming hormone or family starting hormone. This makes sperm. These guys go to the men's testicles, and then the testicles are then going to produce testosterone and sperm. Now, see how this is going to work? It's quite simple. If you take testosterone, your brain's going to pick up on it, and it's going to slow down on this signal. So basically, this signal is going to start to be reduced if you're taking testosterone from an exogenous source. The reason that's going to be reduced because this testosterone levels are going to be so high that therefore your body's going to start making less LH and FSH. Thus, your testicles are going to start producing less sperm and less testosterone on their own. Does this make you infertile? No, it does not make you infertile. Does it decrease your fertility drastically? Yes, it decreases your fertility drastically. Do not get into this whole argument about splitting hairs about whether or not I can or cannot get someone pregnant. You should not be having that conversation and determining off of a YouTube video or an Instagram video whether or not that's true or false. You need to see your doctor and you need to do what's called a semen analysis. A semen analysis, when they actually take your sperm, look underneath a microscope and tell you whether or not you're going to be fertile or not, what your chances are of impregnating somebody. So these fertility tests are very easy to do. There's some that are awesome. They get shipped right to your house. So you can actually do the sample there at your home and then box it up and then have somebody come pick it up. It's really super awesome. If you guys want to do that, you let us know. We can help get you set up with that. Fertility is going to be based off of your age, your sperm quality, DNA quality, that can be affected from different things. So fertility is going to play a role based as you get older. As you get older, your brain signal for this FSH and LH is not going to be as strong as it was whenever you were a young man. And your testicles producing the sperm and the testosterone is not going to be as strong as it was when you were a young man. So keep that in mind, that as we get older, and men's fertility usually stays for many, many, many years, which is great. But it's not going to be as strong as it once was. Primarily sperm count, quality, and motility. Again, if you want to know what your fertility is, you want to run a semen analysis. If you are taking testosterone, it is going to affect these numbers. Now, there is some technicalities here with the testosterone. Because testosterone is administered so many different ways, we have got creams, we've got injections, we have pellets, we have got these oral pills, you got patches, you have gels. There's another new one that's coming out. There's it's not quite intranasal, but it's a different way that it's applied that may be a solution for this. But that's for a whole nother video and a whole nother time. That's why you need to talk to us. We are the testosterone experts. We are the ones that can help guide you in this world. Another common question we have about fertility is that a man will say, I've been on testosterone now for 4 to 5 years and I just met somebody. I'm 45 years old. I had a divorce. I thought I was never going to get married again. I have fallen back in love. The woman that I am with is now 30. Maybe she's younger. Maybe she's 35. Regardless, she wants to have kids. She wants to have my kids. I'm in love with her. Can we get pregnant? Well, let's find out. Let's run a fertility test. Let's find out where you stand. Let's change your therapy. Is there ways that we can try to increase your testosterone naturally and also help increase your fertility? The answer is yes. There are ways that we can do that. There are certain supplements and there's certain medications that we can take to get this side of this whole process working. So that is a possibility. And we've done it before. We've had great results. It's super exciting to see these guys come in a few years later with their kids. It's really, really beautiful. It's such a blessing. And I'm honored that we can be able to assist with that process. So the nice thing about this whole thing about the fertility is that you can see quickly from this graph what the effects are, right? Remember, not everything is etched in stone. Not everything is permanent. There's a little bit of yin and a yang to everything. There's also a yes and a no in probability. The answer is not found in a YouTube video. The answer is not found on social media. The answer is found by seeing your doctor. That's how you're going to figure out where you stand, where your case is. Your doctor's going to run a full blood panel on you. They're going to do a fertility test on you, and then you and your physician have a conversation and take it from there. I hope this helped provide you guys a little bit of information to help direct you in a particular way. If you guys have any questions, we do offer consultations. We are here to assist. We are men's health experts, and we are so proud and so honored, and we love what we do. We'll help point you in the right direction.